Hello, everyone. Thank you for joining. Welcome to our Emma Kiosk demonstration webinar. My name is Ilenia Arango, and I am a sales solution specialist here at Modernizing Medicine and the orthopedic subject matter expert. I'm happy to be conducting today's webinar. For those of you who've never joined a webinar before, there's a control panel to the right of your screen. You can use that panel to list any questions that you may have. It should be located at the side of your screen. Please feel free to write your questions in the chat area as you have them, and I will do my best to answer those as I go along. I'll also save some time towards the end of the webinar, stay past a few minutes past the end of the webinar to answer any questions that I may not have a chance to get to during our webinar here today. I'm excited to be showing you our kiosk feature here. The kiosk has been one of our amazing features that has staff members save time. We're constantly gathering feedback from all of our current clients using the kiosk, and our kiosk currently has a rating of a 4.5. It's also been averaged to save approximately 10 to 15 minutes on new patient registration. So it's a huge time saver and a great feature. Also to highlight, it is part of your monthly membership, so it is not an upcharge. This is something that comes with your monthly subscription. So very exciting to show you here this kiosk today. If you notice, this is our kiosk login page. Patients are able to walk through your office just like they would any other day. They check in. Your check-in staff is able to hand them either an iPad. There's different multiple ways that you can implement the kiosk feature. You can have mobile iPads. Some people set up kiosks in their offices and have them have attached the iPads. Different ways that you can go about establishing this feature to the office. Patients are either able to log in using their patient portal login information if that's something that they remember, or they have the flexibility of logging into the kiosk, which with just their name and date of birth, which is usually the most fast and efficient way, because we usually all remember our name and date of birth. So I'm going to go ahead and log in here. I'm assuming that the patient's already signed in at the check-in desk, and the check-in has started the process so the patient can come in and fill in their information. Here, I'm going to go ahead and enter in the patient's first name, birth. Once we select continue, and there we go. So once a patient has logged in using their personal demographic information, like their name, their date of birth, it is going to welcome them here. Now, if you notice, again, like I said, we do a lot of testing to make sure that we get these features correct and user friendly. If you notice, this has been laid out here, the formatting. We have large letters, so it's a lot easier to read the demographics for your patients. You know, some people have a hard time looking at smaller font. You'll notice that the font here is fairly large and friendly for all users of different demographics. I'll go ahead and select next on the upper right-hand corner, and that's going to bring us to the review and sign. So we've laid out the review and sign page, which is the initial page, to create the waiver forms. These are waivers that can be personally created by your administrator, and the waiver form is a page that the patients can actually not move past initially. So that you feel that they need to sign, obviously that's what you would lay out here. You are able to set the timing for the waivers. You may have waivers that they only need to sign on a yearly basis. You may have waivers that need to be signed every single visit. That is something that is completely set up by your administrator, and then that would be the first thing that your patients see when they initially log into the kiosk. Now I'm going to go ahead and try to tap on the next just to show you and demonstrate how the waivers have to be acknowledged prior to the patient moving forward. So I'm going to go ahead and hit OK here, and then we'll open up our first initial consent here, which is the financial consent as a demo. Notice it'll allow them to read the entire consent, and then they can scroll down and they can select to sign or decline. So I'm going to tap on sign here and allow the patient to sign their financial consent, select done signing, and then it'll bring them to the next consent form. Now this consent form is multiple pages, and now notice that our sign, they're not able to tap it, so it's kind of like forcing them to scroll past all of it and make sure they're acknowledging the entire consent form. And then we'll select Done Consent. Once the consents have been signed, they're then able to move on and complete the remainder area of the demographic information and past medical history information. If you notice, this area here is going to help complete about a third of what the patient's, a third of what needs to be filled out for the office visit note. The first thing I'm going to show you here is the pharmacy. So the patient's able to enter in their own pharmacy information. This patient doesn't have a pharmacy listed, so we're going to go ahead and tap on Add New Pharmacy. Some patients do have mail orders. Some patients have more than one pharmacy. They're able to do all of that here. So I can add an in-store pickup as well as a mail order pickup if I use multiple pharmacies. In this scenario, I'm going to select the in-store pickup because I want to show you one of my favorite features within this kiosk when it comes to adding pharmacy. Notice that it's bringing a map and it's allowing you to see pharmacies in the area. So because this patient has their address listed, their address was not listed for whatever reason, it would identify the location of where the patient currently is, and it is going to identify pharmacies within that area. This is excellent for those patients who don't necessarily remember exactly the pharmacy phone number, or all they can remember is Crossroads. So I go to, for example, the Walgreens on the corner of Military and Okeechobee, and I don't know their number, I don't know their zip code. That can make it very difficult for your medical assistants to add, but this map feature here is really excellent for picking up demographic areas where the patient may be looking for their local pharmacy. So I'm going to go ahead and add this CVS pharmacy here. It's going to zoom in to show me the Crossroads, and then I can select Add. Once we add in the pharmacy, that pharmacy will be listed and follow the patient in their chart. You do also have the ability to add multiple pharmacies, so I can select Add New Pharmacy as well. So if I also do a mail order, I can select mail order and type in the mail order name. At any given time that I need to modify that pharmacy, we can easily do so by edit. So again, fast, efficient, and when you're able to identify them on the map. Your patients will also have the ability to add in their past medical history with these tabs here to the left. Notice that you have medical history here. Once I make that selection, you will notice that the kiosk is very friendly to the patients. In other words, it's not using medical terminology, it's breaking things down for you. Instead of GERD, it breaks it down into layman's terms. We have heartburn. So what we can go ahead and do is go through this pick list instead of filling it out on paper forms. It makes it a lot easier. They have the ability to add notes. So sometimes the patients like to give us a little bit of history with the medical information that they're giving us. Well, I had asthma. I don't necessarily have it anymore, but when I was younger, I used to have it. So they can still give you that history if they choose to in all of these other areas here. And then they'll be able to scroll down and see a list of pertinent medical conditions that may be related to something that they've had experienced in the past. They also have the ability to select other if they ever feel the need that they need to free text type a condition that may not have been a part of the pre-populated list above. You also have past surgeries. So maybe the patient's had surgery in the past. They can come in and tell us the year the surgery took place. Medications. So with adding medications, we all know that this is one of the most time-consuming things. The patients love to come in with a laundry list of medications. And in this case here, they're able to fill out that list for themselves. Emma also does, just to note, have the ability for your medical assistant medications from the pharmacy, but in this case, it's giving the patients the ability to enter in those medications for themselves. If the patient does not take any medications, they have the ability to skip the medication here, or they can go in and say, yes, add medication. And one of the best parts about this is that it's going to pre-populate. We all know the medications are very difficult thing to spell, some of them even to pronounce. So if we want to come in here and say, I remember taking Celebrex, as soon as you begin to free text type, it is going to give you a list of medications that fall within that that spelling there. So it begins to auto-populate for you. And this is checking actually the first data bank space search engine. So all medications on the market should be able to be located very easily. Once a patient selects the medication, it will then give them a list of dosages. So they're able to easily, with one tap, select the dosage that they're currently on. We all know that some patients don't necessarily always remember the exact dosage. They may have not brought a list or may have not brought a bottle to look at. So they do have the flexibility of adding without a dose up above. For those of them that do remember, it's very easy to do a one-tap selection, and then it'll pre-fill that information for them. Moving on, I have the ability to go next or tap allergies here. Either one is going to save the information that the patient's entered and move along. Again, same options here with the add allergies. They have the ability to skip if they do skip. This will mark the patient's chart information with an NKDA. Or they have the ability to add yes, add an allergy. And with allergies, we obviously are very concerned to know if patients have allergies to things like penicillin, but they also are going to have the flexibility of adding other types of allergies, and I'll show you that here in just a minute. Once an allergy is selected, they'll have the ability to indicate the severity of the allergy, the date that it started, not necessarily required, and what the actual reactions are. Once that information has been entered, they could then save it and continue to add a new allergy. Emma will allow them to add medication allergies as well as it does food allergies such as peanuts, peaches, pears. And we'll go ahead and say that this patient has an allergy to peanuts as well. All right. We have orthopedic history here to the left. So we do have medical history, but we have orthopedic history, which is an area that's generalized, allows the providers once in the chart to focus on a particular section of the clipboard to identify, pertinent histories for the related complaint today. I can come in here and say maybe the patient had a distal radius fracture in the past. Maybe it was treated by a cast if they want to, again, give you that history. And then we can move on and indicate any past orthopedic surgical history. You also have the ability, it does have the history of seeing a pain management provider. Social history is also a very important area. We like to ask certain things that are related to compliance by the patients coming in here and adding in, they're smoking, if they've never smoked. So we're going to say never smoked, and then we're going to say their alcohol consumption is maybe 1 a day. And by entering in this information, we're actually going to meet some of the compliance measures, advanced care measures and quality measures that are going to be necessary for the visit note and to stay compliant. Family history is also located here on the clipboard. And the patient has the ability to come in and enter in any pertinent relatives history here. I'm going to say the patient has a family history of diabetes, maybe mom has diabetes, and then we'll select save as well there. Once all of the areas of the clipboard have been completed, the patient is then able to go ahead and select finish and log out. And yay, they're done. Once they're done, they're able to take this iPad back to the checkout desk where the check-in person can then process the patient's information, make the chart ready for the medical assistant to bring the patient back and gather the information. All right, this concludes today's webinar. Thank you so much for joining.